Burke, Director of the Health Policy Research Center here at the Rockefeller Institute of Government. We have two wonderful speakers and a very interesting topic today, and I will introduce them in just a minute. But I wanted to first welcome you on behalf of the Institute's Director, Tom Gase, and Deputy Director, Bob Ward. Just a few logistics before we get started. First, I want to thank the Rockefeller Institute staff who make these forums possible. Michelle Charbonneau, Michael Cooper, Joe Chamberlain, Zach Block, and others for their great work. I also wanted to mention some upcoming forums that we have, one in particular. This Thursday we have Lieutenant Governor Ravitch, who we've worked with this past year, coming to speak Thursday at 10. And I'd also like to ask you to power down any of your phones at this time. We're going to have about 20 minutes for each speaker, and then we'll have time for question and answer after that. We ask that when you have a question, you state your professional affiliation and your name so we know who's asking the question. The topic for today's forum is paying for long-term care, families or taxpayers. Very timely topic. I think we have two of the best experts on this subject, and I'm very happy to hear their remarks today. Just some quick background on why the topic is of interest to us and why we think it's particularly timely. As most of you know, Medicaid is one of the largest payers of long-term care services. And I think this graph demonstrates exactly how big of a payer Medicaid is for long-term care. In New York, we spend a much higher percentage of Medicaid dollars on long-term care when you compare us nationally. This slide shows the percentages and the distribution of Medicaid spending on long-term care versus acute care and disproportionate share hospital payments. Given these numbers and the fact that we spent about $50 million on Medicaid, I'm guessing that long-term care is about $22 billion or so, but I think Mark will give us more details on that. If you look within long-term care at some of the categories and how the distribution of spending occurs compared to nationally, we're higher in some areas, lower in others, and you can make your own judgments about whether that's good or bad. But I think Mark will tell us a little bit more about why we may be spending some more in some areas and less in others. Figuring out how to pay for long-term care is particularly relevant as the baby boomers are aging and people are living longer. In health reform legislation that passed this year, the Accountable Care Act, there was a provision in the legislation called the Class Act to establish a system to provide long-term care insurance to employers. Essentially, the program operates by having individuals pay a premium for 5 years, after which time they're eligible for long-term care benefits that can be used for a wide range of long-term care services. Although the law said that the program was sustainable for 75 years, the Deficit Reduction Commission that you've been reading about in the news this past week said it did not view the program as financially sound. However, it noted that repealing the Class Act would increase the deficit over the next decade because most of the program's premiums are paid up front and the benefits aren't paid out until later. So it remains to be seen what will happen with the Class Act, but I think it's a timely and interesting part of this discussion. To me, one of my questions for the speakers is, should we have faith that long-term care insurance, private long-term care insurance, is a product that will work over the long haul? Will long-term care policies just get more expensive and pay out fewer benefits? I don't know. This is a good question for Sam to answer. Will we see a repeat of what happened with insurance, disability insurance many years ago? I'm not sure. In that market, many of the leading long-term care insurance carriers either went out of business or are no longer together. But sometimes that happens, and maybe that's a normal part of the process. I don't know. We'll see what Sam has to say. New York has been a leader nationally trying to address how to pay for long-term care. In 1993, the state was only a handful of states to begin a program known as the Long-Term Care Partnership. It's a unique program designed to finance long-term care, and it's based on the concept of a public-private partnership, linking Medicaid and private insurance. The program became operational in 1993, has gone through different iterations, and I think Mark will touch on some of those today. So here to talk about those challenges and some of these issues, we have Mark Kissinger. Mark is Deputy Commissioner for the Office of Long-Term Care at the New York State Department of Health. He brings a multifaceted wealth of experience and expertise to his position, including serving as President of the Home Care Association of New York State, the Deputy Secretary for Health and Human Services with the New York State Governor's Office, Senior Program Associate with the New York State Governor's Office, Senior Program Associate with the New York State Senate Majority Leader's Office, Director of the New York State Senate Social Services Committee, and Director of the New York State Senate Committee on Aging. Certainly a lot of expertise there. Sam Morgante leads Genworth Financial's Washington, D.C. Governmental Relations Advocacy on Long-Term Care. Sam has been with Genworth and his predecessor and long-term care insurance companies for 2 decades. In addition to government relations, he manages long-term care compliance, product development, and product implementation functions. Sam has provided expertise and testimony to numerous state and federal government efforts on long-term care financing. He has also been involved in a number of trade association activities both in Washington and in the state capitals. He's also served on the board of the New York State Partnership for Long-Term Care since its inception and was selected as a delegate to the 2005 White House Conference on Aging. Mr. Morgante also served on the Aging Transition Work Group for Maryland Governor Martin O'Malley. He was a senior market advisor magazine, named him as one of 5 people on its long-term care power list, and noted his work in Washington as one of the key industry people clearing the path for long-term care. His background includes senior staff positions with the New York State Legislature, so he's familiar with New York. He graduated from the State University of New York at Binghamton and received a master's degree from Columbia University's Graduate School of Business. Please join me in welcoming our distinguished speakers.